The industry that I've been working most closely with in the last couple of years is healthcare, and their value is an incredibly important lens to look at the world, in so much as our health is something existential, it's something felt, it's something that we hold very precious. So any attempt to think about transformation in healthcare needs to attune itself to this very important dimension. And I've been involved recently in a really important project commissioned by the Royal Free charity, which Royal Free being one of the major London hospitals. And the challenge really was, how does the NHS think about planning and delivering change in a radically changing world? And this was the exam question. So I was basically commissioned to look at the 10 to 15 year future of healthcare and try and use a value lens to think about how we might articulate that future and how we might, through that, start to generate a picture of the journey of transformation that would take us to that vision. Now, what makes that complicated in healthcare, and I'm sure it's the same in many other industries, is there's a transformation in how healthcare itself is organizing itself, moving away from lots of silos to joined up population health. So there's a transformation in structure and function going on. There's radical changes in genomics and personalized medicine coming along. There's huge transformations in sensors, point of care diagnostics, sensors in the body, on the body, around the body are all coming. And of course, pouring out of that is 1,000 million-fold times more data, and what do we do with that? The future of AI, et cetera, et cetera. So you can see from a healthcare perspective, it's utterly perplexing. Where do we start? Where does this journey take us? And how do we think about the transformational journey? So we developed a report that essentially took a value lens of the individual, because health ultimately resides in us, in the way we live. And how we feel and what we can do. So taking the individual as the starting point, it was really an exercise in thinking about how do we, through ever developing technology, get a deeper understanding of our biology, our actions, our contexts, to start out building a bigger picture of what it is to minimize avoidable suffering and maximize individual flourishing. If we take those as our value creation lenses, then what we see is evolving technology is becoming better and better tools from which to solve those problems, and being able to crystallize the future of healthcare as being a person-centered vision, which uses technology as it evolves to be able to answer that question in ever more detail. What it enabled us to do is paint a vision for the future of healthcare, and then look at what would that mean for the institutions and silos that currently sit, the legacy ones in the 20th century, and what direction does that point us towards in terms of the journey of transformation to provide ever more integrated, person-centered care. So really looking through that person-centered frame onto this landscape enabled us to see where is an ultimate future, shared future for healthcare, and how might we then start the journey of transformation to bring those pieces together to deliver this. So ultimately a person-centered approach, but we look through the stakeholder lens of what does value mean for the healthcare system. Of course, sustainable healthcare is a hugely important challenge, with underlying inflation of healthcare costs around 4 to 5% a year. That's unsustainable to the public purse in the long term. We also look through the lens of industry, because in this radically transforming world, there's going to need to be more collaboration and partnership with industry to bring these new capabilities to bear. And having a shared vision that recognizes what's valuable for industry, looking through their value lens, value creation lens, enables us to think about the needs of the individual, the needs of the system, and the needs of the individual elements of industry, how can those start to come together in ways that deliver maximum value to all parties? So it's been a fascinating project. We've now got a report out there. We're now spinning up a not-for-profit to take this out and advocate to policymakers, healthcare leaders, and industry around a shared vision for the future of healthcare powered by technology that can act, if you like, as a North Star for the individual transformation projects that need to undertake underneath that towards building a sustainable, technology-enabled healthcare system fit for the 21st century.